Welcome to the Concierge Medical Marketing Podcast, the show dedicated to helping concierge medical practices grow and thrive. Hosted by Schwartz, a digital marketing expert with over 25 years of experience and a passion for improving American healthcare by helping concierge medical physicians succeed. Here's Schwartz.
Hello and welcome to the Concierge Medical Marketing Podcast. I'm your host, Stephen Schwartz. It's my pleasure to have you along on our discussion today. Thrilled to introduce you to Dr. Doug Krohn. Doug, so good to see you today.
Thank you for having me on your show, Steve. It's my pleasure to be here.
Wonderful, thank you. And your specialty is Konk Sleep, your business that helps people diagnose and deal with obstructive sleep apnea issues. And we're going to talk about that. You're also trained as a pediatrician. We'd like to get a little background on you about that. What led you to start Konk Sleep, and really just what challenges you've experienced, what things have worked well in your marketing, and perhaps how concierge and DPC doctors can work with your company to help their patients have the best outcomes. How's that sound for an agenda for today?
We've got a lot to cover. Let's get going.
All right. Sounds good, brother. So please introduce yourself a little bit. Tell us where you went to school and maybe what made you want to become a doctor in the first place.
Right. So I'm Doug Krohn. I am a pediatrician by training. And to answer that last question, what made me want to become a doctor in the first place? I have to be completely honest. I wanted to make my parents and my grandparents proud. There was nothing better growing up in the 1970s and the 1980s than you could do than be a doctor, to be that person in the community that was serving everybody, who everybody knew, and who was there for everybody in that way. For college, undergraduate, I went to Cornell University. I actually was an English major there, and I wrote for the Cornell Daily Sun. And I was in most ways a writer. And after graduating from college, it was actually shortly after I graduated that I decided to finish up my pre-med requirements. And then I went to the Albert Einstein College of Medicine, which is where I studied, and then I eventually did my residency at Montefiore Medical Center in the Bronx, which has always had a close affiliation with Albert Einstein. How I ended up founding Konk, which is a telehealth platform for the diagnosis, device distribution, and post-therapy care of adults with obstructive sleep apnea. We're for 18 and above. This is not a pediatric initiative. I got there the way a lot of people start businesses. I was a patient. I was on the journey. I was suffering. I had it for 10 or 11 years before I did anything about it. And then once it was time to do something about it, it became immediately apparent to me why I put it off. The journey is filled with pain points. It's filled with surprise billing. It's filled with delays and prior authorizations and insurance approvals. And meanwhile, your health is suffering. And, with sleep apnea, it is definitely a case of where healthcare delayed is healthcare denied. And your body is suffering. Not all of these things can be immediately reversible. And I wanted to change that. And so I decided to come up with a clinical solution that integrates relatively new technologic platforms. And my co-founders and I designed Konk.
All right. So many just points you just threw out on the table right there. And quickly, let's go through them. First of all, the majority of the people who are going to listen to this podcast are physicians, nurse practitioners, DOs. They understand what the symptoms and problems related to obstructive sleep apnea are. For those who are listening who don't know, just rattle off the reasons why you don't want to have untreated sleep apnea.
Okay, so what sleep apnea is, and we'll do this really quickly, is the intermittent obstruction of the upper airway while somebody is sleeping. So they're not breathing, they're not oxygenating their peripheral tissues, and the body goes through a stress response several times a night or several times an hour as a result of this. There are spikes in blood pressure, which can result in hypertension, not just during the day, but during the night, blood pressure that doesn't necessarily resolve when you're awake, or even it may, or even with blood pressure medications, you have to solve the sleep apnea. You're at an increased risk of stroke, of heart attack. You're at an increased risk of car accidents. And then there's all sorts of lifestyle diseases that really make people suffer. Untreated obstructive sleep apnea has a strong correlation with erectile dysfunction, sexual dysfunction in women as well, with anxiety, with depression, with chronic daily headache. It's a very serious thing, untreated. And there was a statistic that came out of the Wisconsin cohort study about 15 or 16 years ago that for every 1,000 untreated patient years of obstructed sleep apnea, there's somewhere between 2 and 4 excess mortalities. So, with roughly 24 million people who have the disease but are undiagnosed, that's about 48,000 excess mortalities a year in the United States alone. It's a serious disease.
Right. So often you talk to somebody, yeah, I don't sleep very well and I'm tired all the time, but I'll push through. It's like, well, maybe you have a medical condition and you're not sleeping because of it, and your body can't heal when it's sleeping. And because of it, you're more likely to have heart disease or these other issues or even die. So, I encourage people to get checked out. I've mentioned on my podcast before that I discovered I have obstructive sleep apnea as well several years ago, and have a ResMed CPAP and the nasal pillow thing. And, I got used to it after a couple of weeks. And now I don't even take a nap without using it. It's revolutionized my life. My health is so much better. I feel so much more energetic. It is so important, if you remotely think that you have sleep apnea, to get it checked out. And, that's what your business is all about, is getting people checked in such a way to streamline the process, speed it up, and get people the therapy that they need as quickly as possible.
Yeah, so we're looking to get people preliminarily diagnosed in under 10 minutes. We're looking to get them a physician review and officially diagnosed and prescribed positive airway pressure within 1 to 2 business days. We're looking for their positive airway pressure device, and we use automated positive airway pressure devices that can determine the patient's airway resistance and automatically adjust. We're looking to get that drop shipped to the patient's home in 1 week. And then immediately we start in with respiratory therapist support. We give virtual video teleconferencing for 45 minutes with a respiratory therapist to teach the patient how to use his or her machine. And then 90 days of support, 90 nights of remote patient monitoring, AI monitoring of the device usage, which goes up to the cloud. So we know in real time when patients are struggling or not responding immediately to therapy. And then we have a respiratory therapist or a sleep coach who can intervene the next day. And this goes on for 90 nights and 90 days.
I love it. So before we jump too far ahead, what is the traditional path that people in the past have gone through in order to determine if they do have obstructive sleep apnea? And then we're going to talk about the special thing that you're doing with Konk that has turned that whole process on its head and sped it up so you can literally deal with this in 10 minutes as opposed to weeks and weeks.
Or somewhere 3 to 9 months would be the typical length of the journey. Amazing. With over $2,000 in out-of-pocket costs. If you're insured, that would be with copays, coinsurance, and deductibles. So the typical journey is you tell your primary care doctor. Your primary care doctor then refers you to a sleep specialist. You have to have a consultation with the sleep specialist. You then have an overnight sleep study, either at home or in a lab. You then have consultation with the sleep specialist again to go over your results. And then you're prescribed a positive airway pressure device. If you're going through your insurance, you then have to go through the process of prior authorization and insurance approval to get your device. Then the device has to arrive at your house. And then who knows what's going to happen? You may get no post-therapy support at all. Sometimes your insurance company decides that. Sometimes it's the DME distributor, the durable medical equipment distributor. They contract out with the insurance the kind of support you're going to give. And you're not getting a doctor or a respiratory therapist determining what your support is. It's the distributor who may or may not hire a respiratory therapist to go out to your house or talk to you on the phone. There are other telehealth platforms that make it a little bit faster, but you still need to have the pre-test consultation, a home sleep test, the post-test consultation. Then if you go through insurance, all the pain points still exist. If you go self-pay, it happens faster. And then regarding that post-therapy support, that 90 days of support, which is crucial because in the current system, 90-day compliance is only about 53% nationwide. Almost half of people have given up on their machine. About 25% of people never take it out of the box.
Oh, yeah.
So with the other telehealth platforms, some provide it, some don't. Most of those who do provide it, it's a la carte. It's not in one bundled financial package. It's not in one clinical interface. And we differentiate ourselves at Konk, konksleep.com. We differentiate ourselves at Konk at every step of that journey, which is what makes it faster and what makes it more cost effective to the patient and to the system.
Right. So tell us just briefly how that process works, the flow of a patient. Let's say my wife says, honey, you're making a lot of noise when you're sleeping and you're gasping for air. I think you may have to talk to a doctor. What should we do? And so I Google sleep apnea or something like that, and I somehow find konksleep.com.
Yeah.
Run us through the process of how it works working with Konk.
Okay, so you begin right away with a virtual frontline workflow. So if you're interested in getting evaluated, we use an adaptive logic questionnaire. We ask a series of 8 or 9 initial questions. It could be 10 questions because your previous responses can determine what the follow-up questions might be. And by weighting informatics and weighting the probabilities that certain responses either indicate or don't indicate sleep apnea, we can get the same informatic power as an overnight sleep study from asking the right questions.
So there, that blows my mind. You have a computer program that's asking on your website, that's asking people a question, they answer it. They ask the next question, they answer it. And based on their answers, it might have different questions for them. And
Yes.
After you said 10 minutes or so of answering questions, that you're telling me is as effective as having a
We're
sleep.
saying that it approximates or in some cases exceeds the overall accuracy of an overnight sleep study. Let me explain why that is.
Yeah, that's awesome.
So we're speaking to a bunch of doctors, nurse practitioners, advanced practice professionals. Everybody understands the concept of pretest probability in our audience. Pretest probability is the likelihood that somebody has a condition even before you test them for it. So remember, sleep centers in general are receiving self-referred patients because they're exhausted, they have headaches, they're falling asleep during the day, they're snoring, and they're driving their bedmate crazy. It is, for the most part, a direct-to-consumer, a direct-to-patient platform. If you have referred yourself to a sleep doctor, then the chance that your problem is obstructive sleep apnea is on the low end 80% and on the high end 95%. So somewhere between 80 and 95% of self-referred patients have obstructive sleep apnea. You can almost make the diagnosis on self-referral alone. We look to fine-tune it by asking questions about somebody's biometrics, their height, gender, their age, their past medical history, whether they have hypertension, whether they have type 2 diabetes, whether or not they're in menopause. If we ask other biometric questions, such as their neck circumference, and then we also ask them certain things about their sleep, whether they snore, whether they gasp, whether they're sleepy during the day. And then in equivocal cases, we go deeper into the degree of their sleepiness. Where are they falling asleep? Is it happening when they're at a traffic light? Does it happen after lunch? So you take all of those questions and you put it together, and you're going to have, if the pretest probability is somewhere between 80 and 95%, An adaptive logic questionnaire is going to have accuracy of somewhere between 85 and 90%. Overnight sleep studies are, also somewhere between 85 and 90%.
Yeah, I remember when I did my first sleep study, it was actually my ear, nose, and throat doctor here in town.
Yeah.
He had a machine and they showed me how to hook it up. I brought it home, I hooked it up, I went to sleep and brought the thing into them the next day. So it was a lot of back and forth and hassles and trying to make sure I did it right. And they were able to determine, obviously, that I had been holding my breath and whatnot throughout the night, prescribed the machine. And as a consumer, as the patient, man, if I could have just hopped on a computer and taken 10 minutes and filled out a form, answered the questions, and it said, yeah, most likely you have sleep apnea. Let's send you a CPAP machine and it'll be configured or whatever to the amount of positive airway pressure that you likely need. And then we'll monitor it from here and we'll consult you and help you. I would have said, sign me up. Let's go. Do you take Visa? You know what I mean?
As most people would, rather than waiting several weeks or several months and then having to sleep for a night hooked up to wires, a lot of them if you're in a sleep lab, less if you do a home test. I also want to point out a few other things about the adaptive logic questionnaire that we use. It doesn't end there. We then have to make sure that this is someone who is appropriate for virtual care. So we go into depth. Once we've identified somebody as probably having it, we ask questions. Do you have epilepsy, narcolepsy? Do you have congestive heart failure? Do you have craniofacial abnormalities that might make breathing difficult for reasons that have nothing to do with the typical causes of obstructive sleep apnea? We ask about their drug use, about their cognitive function, about the presence of dementia, of certain mental health and psychiatric diseases. We go into all of that. We then take into account their medication list. Are they on opioids? Are they on hypnotics? Are they on benzodiazepines? We are not looking to go and give the diagnosis to somebody who likely has it, but also has a complexity that really demands and deserves inpatient evaluation. And then, of course, we take our commitment to public health very safely. We are asking people's occupation. And while we would love to treat everybody, we do think that airline pilots, truck drivers, taxi drivers, mission critical employees, astronauts, not that there's so many of them out there, we make sure that those patients, even if identified by our algorithm as having obstructive sleep apnea, we make sure that they get themselves to a sleep center. We are not looking to be a diagnosis or a prescription mill at all.
I love it. So this is such a fascinating conversation. I love what you're doing. I love that you're streamlining the process so that if someone identifies to you saying, hey, I think I might have this, can you help me? That can make it happen in a period of days as opposed to weeks or as months, as you've said. Let's talk a little bit more about how concierge and direct primary care practices can work with Konk and how you can work with them for mutual success with the best patient outcomes possible. How do you see that working?
Okay, so first of all, I see Konk's model and Konk's paradigm as aligning with the models and paradigms of concierge practice. We offer direct access. We offer care coordination. So direct access to physicians and then coordination of care if it involves more than one specialist, for example, an internist to make the diagnosis and then a respiratory therapist to actually follow the patient and direct the patient in therapy. We offer care coordination. I know that's very important to concierge practices. Convenience. First of all, you don't have to leave your home. And second of all, the front end of this is asynchronous virtual care. The patient and the doctor don't have to be in the same room at the same time. As a matter of fact, we had a patient get diagnosed from the algorithm while watching the Super Bowl a few weeks ago, and then the physician review that patient's chart at 10 o'clock the next morning and get that patient diagnosed. So we don't need to synchronize the doctor and the patient, certainly not in an office at the same time, but not even in a video conference feed at the same time. So you increase the ability for capacity tremendously when you bring people in with asynchronous evaluations. People who've done Roman or Hims and Hers are very familiar with that concept. Another thing that we do that I know is very important to concierge practices is technology integration. People want the available technologies that make care run smoother and more effectively. We have AI remote patient monitoring afterwards. We have the use of a cell phone, the use of a computer screen. We're all used to that right now. But we also offer it in both asynchronous and synchronous modalities. And then, of course, when it comes to actually receipt of therapy, people don't think of this as a healthcare technology, but we're doing drop shipping. That makes sure that the treatment goes out right away and arrives directly at the patient's doorstep without having to get warehoused first, ticketed, picked, shipped, and then sent out again. And then the other thing that we offer that we know is very, very important to both concierge practices and their patients is pricing transparency. There's one price. We have it on our homepage. We have it again at our checkout.
I love it. So you really have streamlined this whole process. And I do truly appreciate your proactive responsibility of making a determination if a particular person really needs to see an in-person sleep specialist based on their career, like you said, an airline pilot and whatnot.
Mm-hmm.
You know, let's make sure that those people get extra care, extra analysis, extra testing, or whatever it might be, because they do truly hold our lives in their hands. I think that's very responsible of you. Often business owners, especially on internet-based organizations, think, man, this one thing, it's good for everybody and everybody should buy it and it's perfect and this and that and the other, but it may not be perfect for everybody. But if you can help thousands upon thousands of people sleep better and have healthier lives through the way you're doing it, and if they do need to take it to the next level and meet with a sleep specialist in their town or area, they certainly could do that, correct?
Most people do not have complex disease or complex comorbidities, meaning other illnesses, and most people are not mission critical employees. But we are more than happy to make sure the people that do fall into those categories receive the appropriate medical care. And so during the interview, if they check one of those boxes, they immediately are brought to a screen that can tell them where a sleep center is by their zip code. And that would be a sleep center that's certified by the American Academy of Sleep Medicine, of which I'm a member.
Very cool. I love how you're doing this. I think there's a lot of benefit. And so if a concierge doctor is listening to this podcast and they think to themselves, you know what, in the past, I've just referred our patients to the sleep center across town or in the next town over, and they would like to work with you, how do you recommend they get in touch with you? Through your website, phone number?
Right. So they can get in touch with me through our website. We have a contact us. We also have a phone number that they can call, and they also can reach out to me directly through LinkedIn. The other thing is, in terms of getting their patients to us, well, they can just send their patients to konksleep.com, but we would like to work directly with practices, and we have already begun to do this with a couple concierge practices. So, for example, we will backlink our websites. We will have guest blogs where I blog about the intersection of concierge medicine and/or functional medicine and sleep care, and I will blog on their website, and so they then have a connection to konksleep.com, and their patients can get directly into what we call the digital clinical interview. We don't call it an adaptive logic questionnaire when we're marketing it directly to our customers, to our patients. We would like to work with concierge practices where we could provide them with QR codes that in which they can issue to their patients. And if they use the Konk Sleep services and go all the way through, we can provide discounts to the patients. We would like to be available to concierge practices that are interested in providing webinars about how a telemedicine obstructive sleep apnea platform might work for them and might work for their patients. And we also have reciprocity. So we have concierge practices that are now putting their blogs on our site with backlinking that leads sleep customers over to the concierge practices. So we would like to work with them in every way. And then, of course, when it comes up to the care coordination that's so important to a concierge practice, again, we have that 90 days of post-therapy support. That's for everybody, and it's bundled all together. There's no a la carte pricing. Everybody gets everything through one clinical interface, one bundled financial.
Yeah, I love it. And for the people listening to this and saying, well, why is Doug talking about these links and websites and backlinks? What's that all about? Just briefly, in digital marketing, it's very important to have links from other people's websites back to your website. These are called backlinks. And the more backlinks you have, the more Google feels that your website must be important. Why? Because all these places are linking back to it, right? If you have a website with no places or no backlinks coming to you, then you must not be that important. So you're farther down on the rankings. So one of the services that we offer through Concierge Medical Marketing is what you've heard of SEO, search engine optimization, a very commonly used and mostly misunderstood acronym. And the whole concept of SEO is helping do the techniques on a website as well as off of a website involving backlinks in many cases, so that your website ranks higher on the organic listings over your competitors, right? So in fact, this brings up a good time. I want to just mention briefly that this is the Concierge Medical Marketing Podcast, and we have the Concierge Medical Marketing Agency where we provide digital marketing services specifically to concierge and direct primary care practices to help them grow and succeed with their businesses, right? And so the three programs that we offer include, number one, transition. That's where a physician is transitioning from an insurance-based practice to a concierge practice, and they need help transitioning those patients to their new, smaller panel. Number two, we offer the program growth, and that's obviously where a practice wants to get to 300 patients or so, and maybe they're at 10 or 15 or none. We have methods of helping do the advertising, the digital marketing, the outreach and whatnot to help the website get much more exposure to the people who are looking for it and for those who are not looking for it, but to plant the seed to help them reach their panel goals. And third and final, we call nurture. And that's for a case where a practice already has a full panel. Maybe they even have a wait list, but things should be done to continue to provide messaging to those patients and wait lists so that the practice stays forefront in their mind so that every year they renew. Okay, so those are the three programs we offer through Concierge Medical Marketing. I wrote a book called The Definitive Guide to Winning with Digital Marketing for Concierge Medical Practices. And the digital download version of that book is available to anybody who'd like to access it. Simply go to conciergemd.marketing, scroll down the page to where you see a cover of the book, put in your email address, click submit, and the system will send you a link where you can download it yourself very easily. As we wrap up our discussion today, Doug, this has been fascinating. Can we talk just a little bit more about what you have done and you and your team for marketing Konk to help the world see that it exists?
Yeah.
And how to get patients and how you make connections with different doctors other than being on, awesome podcasts like this one.
Yeah. So let's talk about the fun stuff, which is the marketing. So what we've led with is a Google ad campaign. And that's what we led with. And by the way, so when it comes, just so I can tell your concierge practices out there what the prospective value of backlinking might be, let me use konksleep.com as an example. Last month on a $538 Google ad spend, we got 8,500 impressions with 5% of them clicking our site. That's a tremendous click-through rate. 8,000 impressions, 5%. Of those 5% that clicked on, 53% did our call to action, which was to take the digital clinical interview. So those are the kinds of numbers that would be available through backlinking. if anybody were to backlink with Konk or other telemedicine websites that might be complementary. So that's number one that we're doing Google Ad. Number two, we're doing general awareness campaigns on Meta, Instagram, and Facebook. For our patient population, which tends to be over 40 and most over 50, Facebook is going to be the more successful platform. We're also a little bit on TikTok. And then we have targeted advertising campaigns that are geo-fenced. And, we're still in beta testing, essentially, from a marketing standpoint. We've decided to target a demographic that has a huge incidence of obstructive sleep apnea, and that's golfers. So today is the first day of the Masters. We have geo-fenced Augusta, Georgia, and the golf course itself. And people who are on that area right now are going to be seeing ads for Konk that have a golf theme. On top of that, we do a tremendous amount of SEO with blogging and video content. We're getting the video content and the blogging up on our site, up on my LinkedIn feed, and also through advertising where appropriate. We already spoke about backlinking. We're doing it that way too. I've appeared on your podcast now. I appeared on the Deep Into Sleep podcast, and that kind of PR is something that we've started. We would love to get traditional print media. People still read the Wall Street Journal, the New York Times. So we'd like to go in that direction. We're hitting every angle. And
I love it.
In many ways, we know that our platform will work for patients. The challenge we see before us is a marketing lift.
Right. Well, here's the deal. You're doing something that we in this industry call omnipresent targeting, right? The idea is we want your business to be seen everywhere where people are, and not just people, but people who are the most likely to need your service and be able to afford it. So doing your paid ads on Google, doing awareness ads on Facebook, Instagram, which is called Meta, doing targeted ads for people who are in and around Augusta, Georgia for the Masters. It's genius. It's very, very smart what you're doing, so that in the concept of omnipresent, you are present all over the place where people see you and they can click and follow, they can learn, they can watch videos. One thing I would add, if you're not already doing it, is the concept of retargeting, sometimes called remarketing. I like calling it reminder marketing. Simply when people come to your website, it puts a cookie or a pixel on their device, their browser, their account. And then when they go to other places on the internet, they'll see your ads over and over again. We as consumers have seen this happening all the time when we're researching something. And then it seems like immediately afterward or the next several days, we see ads for that same thing over and over again on different websites, reminding us to go back, to learn more, research more, and click the magic button and purchase the service. So, Doug, this has been a great conversation. We're running out of time today. If someone wants to get in touch with you, give us your website one more time, please.
Konk Sleep, K-O-N as in Nancy, K, S as in Sam, L-E-E-P as in Peter, konksleep.com. Feel free to send an email through the Contact Us. Everything goes to me, not just it goes to my administrator, but every email goes to me as well. Feel free, Douglas Krohn, K-R-O-H-N, on LinkedIn. That's a great way to reach me too. And I would love to work with every concierge practice that's interested.
This has been my pleasure talking with you, Doug. Thank you for your time. Thank you for sharing your story. Thank you for coming up with this amazing concept of helping people sleep better and to get that care that they need much faster than the traditional way it's been for all these years. Again, I'm your host, Steve Schwartz, with the Concierge Medical Marketing Podcast. And folks, we appreciate you liking, subscribing, following, clicking, sharing, tweeting, whatever. Thank you for being here with us and for sharing it with other folks that could get value from our podcast. We appreciate you, and we will see you on the next episode.
Thank you for tuning in to the Concierge Medical Marketing Podcast. Please subscribe and leave a review wherever you listen to podcasts, and stay connected with us on social media. To speak with Stephen Schwartz about growing your concierge medical practice, give him a call at 772-304-2420 or visit our website at conciergemd.marketing. We will see you next time.